Good morning friends, welcome to the Ayush Darpan YouTube channel. Today, amid the coronavirus outbreak, I'm here to tell you something that you must be hopeful about coronavirus. The death toll of COVID-19 is on the rise, and so is the total number of cases. In the context of this global pandemic, feeling overwhelmed by all the negative information is a natural response. But researchers are also hard at working to try to understand, treat, and prevent the new coronavirus. We take a look at some of the results. As of yesterday, total number of deaths from COVID-19 across the world has surpassed 10,000. Currently, the total number of confirmed COVID-19 cases across the globe stands 2,44,000. These numbers can induce restlessness and worry. The importance of taking precautions and staying safe during this global pandemic cannot be overestimated. But it is also helpful to look at some emerging research that could pave the way for future treatment and prevention. Infection control measures work. The importance researchers in Hong Kong have evaluated the impact that the outbreak has had on 43 public hospitals there. The numbers are encouraging. In the first 6 weeks since the start of the outbreak, 413 healthcare workers dealt with 42 confirmed cases of COVID-19. Of this employees, 11 had unprotected exposure for the new coronavirus. As a result of implementing best practices for infection control, none of the healthcare staff contracted the virus during the study period. Furthermore, no hospital-acquired infections occurred. Dr. Vincent C.C. Cheng from the Department of Microbiology at Queen Mary Hospital in Hong Kong and his colleagues conclude, appropriate hospital infection control measures can prevent healthcare-associated transmission of the new coronavirus. Vigilance in hand hygiene practice, wearing of surgical masks in the hospital, and appropriate use of personal protective equipment in patient care are the key infection control measures to prevent hospital transmission of the virus. Getting the virus may protect against reinfection. A study involving 4 rhesus macaws found that contracting SARS-CoV-2, the virus that causes COVID-19, protected against future reinfections. The scientists reinfected 2 of the 4 monkeys with the virus 28 days after the initial infection. A total of 26 nasopharyngeal and anal swabs tested negative after the re-exposure of SARS-CoV-2, report the researchers. The euthanasia and necropsy of one of the 2 monkeys confirmed these results. Taken together, our results indicated that the primary SARS-CoV-2 infection could protect from subsequent exposure, which have vital implications for vaccine design and disease prognosis, conclude the authors of the study. MNT contacted Martin Bachmann, a professor of vaccinology at Oxford University's Jenner Institute in the United Kingdom, on the broader subject of COVID-19 and building up immunity to the virus. I can tell you, if you got COVID-19 and you got really sick, I'm sure that will make an antibody response that will also last, said Professor Martin Bachmann. Professor Bachmann, who is also head of the Department of Immunology at the University of Bern in Switzerland, continued, but if you have the virus and it only replicates a little and never really reaches the lymph nodes, then maybe you don't really make an antibody response. But then you have not been really sick. Of anyone who has been really sick, I would be surprised to find that who didn't make an antibody response. A vaccine is being trialed, more underway. A trial is currently taking place to test a potential SARS-CoV-2 vaccine for the first time in humans. The National Institute of Health, NIH, have funded the trial, which is taking place at Kaiser Permanente, Washington Health Research Institute in Seattle. In the trial, 45 healthy volunteers will receive a vaccine that contains a segment of genetic code copied from SARS-CoV-2. As the vaccine does not contain the SARS-CoV-2, the participants will not develop COVID-19. Government officials caution that it may take 12-18 months before the vaccine reaches the market, and explains that the main purpose of the current trial is to make sure that there are no serious side effects. However, many other efforts are underway for devising new vaccines. In this article, our research editor, Yella Hewings Martin, PhD, rounded up several projects that identified a potential vaccine and therapy targets for SARS-CoV-2. An old method could fight COVID-19. Doctors may be able to use an age-old method called passive antibody therapy to treat COVID-19, suggests research featuring in the Journal of Clinical Investigation. The researchers who authored the page say deployment of this option requires no research or development, as the method has been around since the 1930s. The method involves collecting blood from a person who has had the virus and recovered from it. Using the serum, the part that contains infection-fighting antibodies, researchers hope to be able to inject another person, thus either preventing an infection or helping to fight it off. Dr. Arturo Quesada-Bell, a professor at Johns Hopkins Bloomberg School of Public Health in Baltimore, MD, and co-author of the newspaper, say, "It's all doable, but to get it done, it requires effort, organization, resources, and people who have recovered from the disease who can donate the blood. Our immune system could defeat the virus." A new case study appearing in the journal Nature Medicine documents the case of a COVID-19 patient who recovered from the condition within days. The patient was a 47-year-old woman who had contracted the virus in Wuhan, China, the main center of the coronavirus, and the researchers examined her immune response in their effort to understand her recovery. Professor Catherine Kedzierska, head of the Human T-Cell Laboratory in the Department of Microbiology and Immunology at the Doherty Institute in Melbourne, Australia, and her colleagues found an increase in immunoglobulins, the most common type of antibodies in the woman's blood samples. The scientists also found a high number of key immune cells such as specialized helper T cells, killer T cells, and B cells 7 to 9 days after symptom onset. This is an incredible step forward in understanding what drives the recovery of COVID-19. People can use our methods to understand the immune responses in larger COVID-19 and also understand what's lacking in those who have fatal outcomes, said Professor Catherine Kedzierska. Thank you for watching the video. If you like the video, kindly like the video, share it among the community, and comment down your opinions about the video. Thank you.